in treating full mouth rehabilitation cases. If anyone interested to learn corticobasal implants, especially full mouth cases, how to do, I will teach step by step. So I do workshops as well as one-to-one interaction workshops also we do. So one-to-one teaching also I do. So you can contact me on 9738369221. That's my number. So especially corticobasal implants are the happening things now, because here we are going to load the implant with the processes within a short period. We load the implants within a short period because here the process of integration, the method of binding of the implant with the bone is through osteofixation or osteomodulation. Through this, since we are going to engage the implant in the D2 bone, or sometimes we get D2, D1 bone also, so we get good stability, anchorage, and also good torque. So in such cases, we can load the implant with the processes immediately. So that is what we do in immediate functional loading. Even when there is a partially edentulous cases of one or two teeth missing, we do load that implant immediately depending upon the primary stability and the torque we get. Okay, so compared to conventional implants wherein we have to wait for 3 to 4 months for osseointegration, then go with the prosthetic part. Here we won't wait for 3 to 4 months. Since the method is through osteofixation, we can go ahead with the prosthetic procedure by using the impression copings and analogs and the next prosthetic steps. So either you can give temporization, you can do the temporization with the temporary processes, or otherwise you can, if the stability and anchorage is good, you can give the permanent processes itself. So after the placement of the implant. So here the whole process will take 72 hours. Usually we do it in 72 hours because in this 72 hours period there will be bone remodeling which is going to happen. So the loaded implants will have better distribution of forces during this period, and also you will get good anchorage and stability for this implant during this period. So we have to load this in 72 hours or maximum of 4 to 5 days. So that is what the advantage of corticobasal implants when compared to the conventional implants. So and also it's a patient friendly approach, corticobasal implantology, because no incision, no flap opening, not much of bleeding. So we just we use only 2 drill technique, that is the initial drill of pilot and followed by the conventional, or the conical or the twist drill we use. So only with the 2 drills only you can place the implant. Sometimes only with the pilot drill, after the completion of the osteotomy with the pilot drill, you can place the implant. So that is the way. It all depends on the type of bone and your assessment of CPCT or OPG for that particular case. So all should practice corticobasal implantology because it's a technique sensitive kind of. You have to be thorough with the anatomical structures. If you are good at anatomical structures and good at osteotomy, good at basics of placing the implant, you can go ahead and place the implant. Thank you.